Hello everyone. Today we are here with Dr. Brinda Sitaram, who is the Group Director of Psycho Oncology at HCG Hospital. Now, I'm a head and neck oncologist, and when I joined HCG, that's when I was introduced to the term Psycho Oncology, and it was something really new to me. So I thought, why not we have the master of Psycho Oncology herself tell us a little bit more about the field of Psycho Oncology.
Thank you.
So ma'am, what is Psycho Oncology all about?
To put it in very simplistic terms, psycho-oncology is a science that addresses the psychological issues and concerns of cancer patients and their families. This whole science is very nascent. It started off only in the late 1970s and gained momentum over a period of time. But in India, we are kind of, late starters, as it were. The whole science started to gain momentum in the last 10-15 years, as it were. But having said that, it's very heartening to know that the base of psycho-oncology has kind of expanded. When the movement started, it was in the space of only palliative care for a long, long time. And I think we have come out of that space primarily because now cancer survivorship is increasing. As more and more patients are living, to see normal life, obviously there are various psychological issues and concerns also that are kind of beginning to manifest. So the base has expanded from preventive oncology throughout the cancer journey, as it were, the cancer trajectory, to palliative care and even end-of-life care. So oftentimes, it's a media favorite question for me, what is the scope of psycho-oncology? And I tell them that it is from womb to tomb and beyond. When I say beyond, families require a lot of help in terms of grief and bereavement management and so on. So the base is really, really expanded with time, and however condescending it may sound, I feel very proud to say this, that much of the landscape of cancer treatment has obviously changed primarily because of the inputs that have come from psycho-oncology. For example, surgery. As a surgeon, you would know, organ preservation is the order now. Yeah. Because we started to show you data about what is happening to quality of life when organs get sacrificed. When patients lose their speech or women lose their breast and so on, what happens emotionally to them. So that is where, we have kind of changed the landscape of cancer treatment. That is the science of psycho-oncology.
Right, ma'am. Very true. I mean, I know that there are a lot of things that we couldn't absolutely do without inputs from you. So how would you think that you intervene, what psychological interventions do you use to help patients with their emotional well-being?
Interestingly, because it depends on the kind of psychological impact that patients really go through and their families go through as well. There's enormous amount of, anxiety, depression, loss of self-esteem, body image issues, sexual difficulties, roles get altered. So there are lots of, marital issues and so on that patients and their families really, go through. So it's not like a one-step treatment, as it were. I would say it's a cocktail therapy. Because patients just don't present only with depression or only with anxiety. It's a mixed bag. They could be depressed, they can also be anxious, they can also be going through, marital difficulties, family strains, role reversals, making adjustments with this new normal, as it were. So we use multiple techniques to kind of, restore the individual. Having said that, I think I want to put one thing to rest here. I think oftentimes people ask me, is it counseling? No, it's not counseling. Counseling is a very small, minuscule aspect of a whole gamut of, psychological techniques and tools that we have. Psycho-oncology is a super specialty. It is not to be used very flippantly or loosely as just mere counseling. It requires enormous amount of training and, skill to deal with the emotional complications that patients go through. So I would kind of take you one step before we talk about the techniques, because it is important, because cancer scenario is very, very complex, as you would appreciate as a surgeon. It's very important to understand that scenario very completely before we engage them in any kind of psychological interventions or therapies, as it were. Number one, we don't know whether there could be a metastatic process going on in the brain. Those also can cause a lot of emotional upheavals in patients. Number two, cancer itself emits a lot of chemicals that can bring about emotional imbalances. Three, the biochemical variations and the electrolyte imbalances can alter the emotional makeup of an individual. Then, drugs, particularly chemotherapy agents, are notorious to cause a lot of emotional difficulties in patients. Like even simple drugs like steroids, antiemetics and so on. Unless we have ruled these possibilities out, we cannot really engage them in pure psychological intervention. Sometimes we may have to use a combination of all this. We would have to ask a psychiatrist to step in. But having said that, less than 2% of our patients really require any psychiatric help, because our patients are not psychiatric. They're dealing with a life-challenging situation, and much of their emotional difficulties can be handled by psychological interventions and techniques. And the techniques are a whole gamut of things, and it has to be customized, tailor-made to meet individual needs, and mind is dynamic. So these techniques keep changing between sessions as well. So there are a whole range of things that we do in the psycho-oncology space.
Thank you into the insights into your practice, ma'am. I think that psycho-oncology has now become a mainstay in our practice, at least. I know that you contribute a lot towards, how we look at treating our patients and how we prep our patients for surgery or for any kind of treatment. Do you think that psycho-oncology has now become a mainstay in most cancer hospitals?
While the international guideline is that it has to be integrated into mainstream cancer care, and emotional well-being now is considered the sixth vital sign. The 5 physical vital signs, like you would do for all the patients when they come into your clinic, is that you would look at their physical vital signs such as blood pressure, temperature, heart rate, pulse, and you would even understand whether they have pain. Now, emotional well-being is considered the sixth vital sign. So according to the guideline, all cancer patients must be screened for emotional well-being, and psycho-oncology services must be integrated into mainstream cancer care. But the disheartening part is that while there is this huge prevalence of psychological distress, to the proportion of nearly 75% of patients really require emotional support and help. And our own Indian data has shown that nearly 92% of patients who were screened for emotional difficulties, 92% of them reported emotional, challenges and so on. For such a vast, or I would say the intensity and magnitude of the problem, in the Indian context, we are only about merely anywhere in the zone of 20 to 25 psycho-oncologists in the entire country. And when I talk about psycho-oncologists, these are qualified, trained people only in the domain or in the super specialty of psycho-oncology. So for a population such as ours, where we are really having nearly 25 lakh cancer patients, we are nearly 20 to 25 psycho-oncologists. So it's really not even a drop in the ocean. So we have really miles to go before we catch up and say that we need to integrate this into mainstream. But having said that, at least oncologists now in cancer hospitals are sensitized, they're aware, and I keep getting these calls practically every day to find out if I have any students who are trained, who can be placed in their hospitals and so on. I think we are getting there. At least that awareness itself is a huge beginning that we have made. Ideally, yes, all cancer centers must have, the psycho-oncology service to attend to patients' emotional well-being. Particularly now, like I was mentioning, cancer patients live to see life. So therefore, the transition into this near normal or a new normal life needs to be handled with, absolutely kid glove. Right. And that is where you need expertise to kind of, take care of their emotional needs.
Right. Thank you so much, ma'am. If you would like to know more about the psycho-oncology service, please write to us in the comment section. And thank you so much for all the wonderful insights today, ma'am.
Thank you.